Deep brain stimulation is an incredible therapy that we have to implant into the brain and the chest. The wires that are implanted in the brain, they target regions of the basal ganglia and or the thalamus that can be really helpful for people with movement disorders. And so starting with Parkinson's disease. In general, there are two parts of the brain that we use most commonly. One is the subthalamic nucleus, also known as the STN, and the globus pallidus interna, that's the GPI. Let's do one at a time. So the STN, the subthalamic area, this is a tiny structure about the size of an almond or smaller that sits under the thalamus and has been found to be heavily involved in tremor. So if we have patients, especially tremor-predominant Parkinson's patients who really can't get medication to control the tremor, this is really the best target. And there's actually lots of benefits with STN in addition to tremor control. Of the two targets, it actually allows us to aid patients in lowering their doses of medication. And so for a patient who takes high doses of medication or takes the medication frequently during the day, and perhaps there are side effects associated with that, that can be a huge help for the patient. So lowering medication and controlling tremor, these are great reasons to use the subthalamic nucleus. The GPI is a different structure, but overlapping in functionality. We typically use the GPI to help people with aspects of Parkinson's disease like rigidity, patients with severe fluctuations in dyskinesia. GPI can be extremely helpful for these symptoms. We see benefits for patients with tremor as well, but probably not as much with the subthalamic nucleus. In my practice, we do about 50% of patients getting the subthalamic nucleus and about 50% getting the GPI, because we really try to tailor each surgery to each patient as his or her own sort of individual plan. The VIM, the ventral intermediate nucleus of the thalamus, is the part of the brain that was, by the way, first approved for deep brain stimulation a long time ago, but for tremor. And it seems to be, at least in my practice, most typically used for patients with essential tremor. It's also helpful for certain patients with Parkinson's that have tremor at rest, perhaps in the absence of other Parkinsonism or other symptoms of Parkinson's disease. But typically this is the target for essential tremor.